my name is Vanessa van Dijk, and in this video we are looking into how you can use your tretinoin cream. Now first of all, I want to go over the difference between retinol and tretinoin, as this can be quite confusing, and this also can influence the way on how you're going to use your product. So if you already know for sure that you're working with a tretinoin cream, you can skip this part right here, move on to the next part. You will find the timestamps below. However, if you aren't sure about the difference and what you're currently using, well then please keep on watching this specific part as well. Now I want to go over some examples so that you can see it visually and have a better understanding of it as well. So first of all, here's an example of a tretinoin cream, which is often being used to treat acne. And you can get it in different strengths. If you're being new to it, start always off with the lowest percentage and move your way up if you should feel the need. In most countries, you need to get a prescription for it, so you cannot get it over the counter. There are a few exceptions, and therefore I want to do this video. But still, this just should give you already an idea of, well, why is it only available via prescription, and why can I get my retinol product like this over the counter? Well, this is mainly because tretinoin is already retinoic acid, which is what the skin needs to work with it. And so it is already much more potent than retinol, and it can cause more irritation than retinol because it immediately works on the skin, and therefore there are certain ways that you have to keep in mind when working with your tretinoin cream. Whereas on the other hand, you have your retinol, which is available in serums or creams, and it is available in different strengths, as you can see right here as well. I just picked a few examples, and this is mainly being used as an anti-aging product. Now your retinol is not yet retinoic acid, so it has to get into retinoic acid before your skin can use it and do something with it. So it has to go over a process of 2 transformations. This already makes your retinol product less potent, and the signs of irritations aren't as severe anymore. You still can experience them, and of course the overall formulation of the product matters as well, and the strength that you're using, but it is already like less severe on the skin when using it. Again, start off with the lowest percentage and move your way up if you should feel the need. Now with your retinol product, there isn't really a specific guideline that you have to follow, except if you would have a 1% retinol treatment, such as the one from Paula's Choice, which is quite potent, and then you could go ahead with the same guidelines that would apply to the tretinoin cream to reduce signs of irritations, because otherwise this can become quite uncomfortable. But with lower percentages, there isn't much that you really need to be careful of. Like generally speaking, do not use your exfoliating acids in the same way with your retinol. The same would apply with strong vitamin C ascorbic acid products, and then for the rest you are good to go. So there isn't really much that you need to keep in mind to be careful with. Whereas with your tretinoin cream, as it is so much more potent, and because it immediately works on the skin and can increase the risk of irritation quite dramatically, there are certain ways that you have to keep in mind when using it. And so this is now where I want to go over an overall general guide so that you have a better understanding on how you should use it. So for this, I'm going to go to the website of WebMD. I'm going to put the link in the description box down below if you want to read through it in your own time. Of course, if you have gotten your tretinoin cream from your doctor, please follow your doctor's advice. However, if you live in a country where you can get your tretinoin cream like this over the counter, then this can be quite helpful so that you're making sure that it's as pleasant as possible. So first of all, again, we just have the uses right here. It's often being used to treat acne, as already mentioned earlier. And when it comes to a how to use guide, it specifically starts off with: wash your hands before applying this medication. Gently clean the affected skin with a mild or soapless cleanser and pat dry. So when it comes to a cleanser, they're talking about a gentle cleanser, so a non-exfoliating acid cleanser. A cleanser that's suitable for your skin type, that feels good on the skin, does not irritate the skin in any way, and that you can then use your tretinoin cream afterwards without any concerns. And the first example would be Cetaphil's cleansers. So you have once a daily facial cleanser if you have a combo to oily skin. The other one would be the gentle skin cleanser, which is great for normal to dry skin. Another example would be CeraVe's hydrating cleanser for normal to dry skin, or even CeraVe's foaming cleanser if you have an oilier skin type. But again, keep in mind with your tretinoin cream, the same would apply to certain retinol products as well, your skin can become much drier, and if that's the case, you may want to switch your cleanser towards a cleanser that's more suitable for dry skin, because an oily skin cleanser, if you used to have oily skin, can be quite like drying on the skin. So you really need to balance it out, but this is what I mean when I'm referring to gentle cleansers. Those are just a few examples. Then it says, after you have washed your face with your gentle cleanser, apply a small amount of medication, about a pea-sized amount, in a thin layer, usually once daily at bedtime, so in your evening skincare routine, or as directed by your doctor. So again, if your doctor has given you a different advice, please follow that specific advice. So you're going to wash your face with your cleanser and then you're going to apply the medication. But there's one more important point that you have to do in between, and this is wait 20 to 30 minutes after cleaning your face before applying this medication. This way you're making sure that your skin becomes completely dry, which can already dramatically reduce the signs of irritation. And this is often the confusing part, where I read in my comments that if you are working with a retinol product, you think that you have to wait the same amount of time in between. This may be helpful, again, as already mentioned, if you have a 1% retinol product, then like letting the skin dry and then applying it, it can already help to reduce signs of irritation. However, if you're working with a less potent retinol product, this isn't really needed. You can immediately use your retinol after your cleansing step. But again, with your tretinoin product, the waiting time in between so that your skin can dry is important to reduce signs of irritation. Then it also says, do not apply to the inner lip area or inside the nose or mouth. Do not apply to cut, scraped, sunburned or eczema affected skin. Again, as this can really lead to extreme irritation because your skin is being compromised, and especially like the inner lip part right here, or getting it too close to the actual lip in general, or too close to the eyes right here and your nose. This is really where the skin is quite sensitive, and so if you're getting it too close to that specific area, it really can give you like an irritation that's quite severe and uncomfortable, unless you would really be careful and use a moisturizer around those areas so that you have kind of like a barrier so that you're not getting it too close when blending your tretinoin cream all over. Then if this medication gets into your eyes, flush with large amounts of water and call your doctor if eye irritation develops. Wash your hands after using the medication to avoid accidentally getting it into your eyes. So it really breaks it down step by step on what you have to be careful as well as how you should use it. So let's move on to the next part of side effects. So right here it says, a brief sensation of warmth or stinging may occur immediately after applying the medication. Skin wetness, dryness, itching, scaling, mild burning or worsening of acne may occur during the first 2 to 4 weeks of using the medication. These effects usually decrease with continued use. A daytime moisturizer may be helpful for excessive dry skin. So you can work with a moisturizer during daytime so that it can balance the dryness as well as the side effects so that your skin feels a bit more comfortable, especially in the very beginning. And so when it comes to moisturizer recommendations, the ones that I can recommend are from Differin. They are just purely examples. The first one would be the Differin Soothing Moisturizer, as well as their Restorative Night Moisturizer. Those are great examples, feel good on the skin and do not irritate the skin. However, if you're looking into a different moisturizer or you have already been using a moisturizer that works well for you, does not irritate your skin in any way, but calms the skin and it feels like more comfortable on the skin, well then go ahead and keep on going with that specific moisturizer. Also, right here it says that if any of these effects persist or worsen, notify your doctor or pharmacist promptly so that they can immediately help you with your current situation. So let's move on to the next part, which would be precautions. Now right here it says that this medication may make you more sensitive to the sun. Limit your time in the sun, avoid tanning, boots and sun lamps. Weather extremes such as wind or cold may also be irritating to the skin. Use sunscreen daily and wear protective clothing when outdoors. Now again, during daytime it is still important to work with sun protection when being exposed to direct sunlight. And so there you have the option, either use a moisturizer and then a separate sunscreen afterwards, or immediately work with a 2-in-1. And so if you are looking into the 2-in-1, then I can recommend 2 great moisturizers with SPF from Paula's Choice. The first one would be the Skin Restoring Moisturizer with SPF 50, which is usually recommended for normal to dry skin, or their Resist the Earth Extending Daily Hydrating Fluid SPF 50, which again is more so suitable if you have an oilier combination skin. So the first one would be a bit more of a thicker cream, whereas the second example would be more so a fluid, which is much lighter on the skin. And again, when looking into such products, make sure that they do not irritate the skin and feel comfortable on the skin. It also does emphasize that wait until your skin has completely recovered from a sunburn before using tretinoin. So you either had already a sunburn before even starting with tretinoin, so then give your skin like a bit more time so they can recover before starting of using the product, or while using the tretinoin cream and for whatever reason you got a sunburn, then stop using it during that time so that your skin can completely recover and then start again. Then it also says right here, avoid electrolyzers, waxing and chemical depilators for hair removal on the treated areas while using this product, because again your skin has become extremely sensitive and can irritate quite quickly. Also, right here it says, during pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Discuss the risk and benefits with your doctor. It is not known whether this drug passes into the breast milk. Consult your doctor before breastfeeding. So please keep this in mind when thinking of using a tretinoin cream. Now there's one last point that I do want to cover, which is under interactions. Right here it says that drug interactions may change how your medications work or increase your risk for serious side effects. Some products that may interact with this drug include hair perming solutions, alcohol, lime, menthol containing products such as astringents, toners, shaving lotions, medicated or abrasive soaps and cleansers, products containing sulfur, resorol or salicylic acid, products containing alpha hydroxy acids, products containing glycolic acid, soaps and cosmetics with a strong drying effect. So if you have such products at home and at the same time you want to use your tretinoin cream, keep them separate or do not use them at all, especially in the very beginning, because the tretinoin cream can already cause so much dryness and the risk of experiencing side effects is quite high as well, so that you can keep the routine as simple as possible. And then you may want to adjust it in the future if you should feel the need, but best would be keep it as simple as possible. And so right here on the bottom it also says that benzoyl peroxide can be very irritating and may decrease the effectiveness of tretinoin if the two products are applied at the same time. So for whatever reason you may want to do this combination, because benzoyl peroxide is not a treatment as well, keep them in separate routines or use them on alternate days. But this again can be quite drying on the skin and the risk of experiencing more irritation is quite high. So therefore when doing this combination, be careful and if you can, talk to your doctor for the best advice. But so this is the last part that I wanted to share with you, to go over on how you can use your tretinoin cream and understanding the difference between your retinol and your tretinoin cream, because overall retinoids in general can be quite confusing. But this is what I wanted to share with you. I do hope that you enjoyed this video. Also, if you like my videos in general, if you like my work that I'm doing, the presentations, PowerPoint slides that I'm always sharing with you in my application videos, if you find them helpful, I would highly appreciate and be extremely thankful if you could leave a tip to support my work. You will find the link in the description box down below. It is a PayPal link. However, if you want to support my work in the free option, then of course giving it a thumbs up and sharing this video and subscribing to my YouTube channel is extremely supportive as well, so that my videos will get more attention to clarify certain application issues as well as skincare problems that you may have. And so thank you so much for watching. I hope that you enjoyed this video, that you could learn something, and this is what I wanted to share with you, and I will see you soon in the next one. Happy skincaring. Bye.